In Kenya, our healthcare system is facing a serious crisis. Hospitals are struggling because there's just not enough funding. You walk into a hospital and often the medicine you need aren't there. Services are stretched thin and crucial equipment is missing. And if that wasn't enough, an ongoing doctor's strike has left so many people without the care they desperately need.
I've come from a place called Bolo Mission, that there is an hospital there, but no medicine. Buying the medicine is nowadays very expensive. When you go to the government hospitals, you can be treated, but no medicine.
But these aren't just numbers or statistics. These are real stories of pain and hardship. Imagine mothers unable to get medicine for their sick children, or elders waiting, often in vain, for the medical attention they deserve. Families are being torn apart by illness that could have been treated if only the right resources were available.
Lit kanyono pinto chalo kudo chalo nganyono kudo to wanga kamach hospital kidhi titi Dr. Pimi tindi kuni yath kaka nondik na yath making'iewo dwe achiel 1,000 taonge gi pesa koro aketo barup daktari kanyo mar yath okayud kaka ng'iewo yath.
Yet, despite all these challenges, there is hope. For nearly a decade now, a free medical camp has been held every July to tackle these very issues. It's here that people can finally get the medical attention they've been waiting for. And it's all provided free of charge.
Wakati nilikuja mara ya kwanza, nilisikia kwa redio ya Lake Victoria kama wanatangaza ati kuna mahitaji ya nini ya kusaidia watu hapa yani ya bure. Sasa hiyo wakati nilikuwa mgonjwa sana, hata nilikuwa nimesaenda huko Russia, wakanitibu na sikuona mabadiliko. Nilipata Dr. Willis. Sasa Dr. Willis alinipima akanipeleka kwa Russia, akaniandikia niende Russia kwa room 16. Sasa nilienda Russia, nilipata matibio huko. Leo nilirudi, nilikuwa nasikia ugonjwa ingine tena. Hiyo ile ya last year nikapona kabisa.
For me to find people being treated in this magnitude freely in Nyakach as a sub-county, that is very unique.
Mimi ni Filgona Aoko Musa. Nafurahi na madaktari, nafurahi na watu wa kanisa kukuja kutusaidia wale watu ambao hawana uwezo. Hospitali hakuna dawa. Meno nimetolewa, sasa natasikia vizuri. Dawa nimepewa, nimenyooshwa mguu vizuri sana.
Behind this incredible effort is Pastor Joseph Jesudason, an Indian Christian pastor who's been the driving force behind this medical camp.
I'm Pastor Joseph Jesudason of the International Community Church, and I don't like to even mention my name because it's all about Jesus. What's the big deal about me now? People come and go, isn't it? Pastors are buried like everybody else, isn't it? Only Jesus rose again from the dead, nobody else. So I give him all the glory. It is about Jesus, not about me, not about my church, but we are thankful that we are used to help out poor people. People are suffering a lot, no money for medicines. They are suffering a lot, no money for school fees. They're suffering a lot. Even some of them can't even eat food. So we give all medicines free, all the treatments free, everything free. And when they go out, we give them a loaf of bread, bottled water, and we give them UHT milk, so that it is a milk they can carry at least. Put them in a bag and send them in the love of Christ.
For ICC, words, no matter how powerful, may not be sufficient to express my height and depth of gratitude for what they do, for all they have been, for all they are, for all they say and do. May every good and perfect gift come their way. I must confess that this gesture has left indelible marks in the lives of many people that they have reached. Perhaps I'd only request that they consider coming again and again. This should not be the last time. God bless you, ICC. God bless the sponsors, the donors, the organizers. Mbarikiwe sana.
Pastor Joseph is a teacher by profession and has spent over 40 years dedicating his life to educating students in Homa Bay, Kisii, Nyamira, Nyakach, Kisumu, and beyond. He loved his job, and he always had a soft spot for the underprivileged students who couldn't even afford simple medication. This initiative, called the Medical Mission of Compassion, has been offering these crucial services to the less fortunate since 2017. For the first few years, the camp was set up in Bondo sub-county, but for the past 3 years, it has been in Pap Onditi, Nyakach, continuing the good work of serving the people in need.
For 3 years, we did Medical Mission of Compassion in Bondo, and then afterwards there was the China virus, so we all have to take a break. Nobody could travel. So 1 year gone, and then we got back up again and then resumed. But after 3 years, God led me to Pap Onditi, and the person who led me to this wonderful location with much prayer is Pastor Janet Aumakisia. She said, Pastor, consider this location. A lot of poor people and a lot of people with eye problem, dental problem. Why don't you come? When I came, this place was not at all right. The ground was not good, and the hall was all mud. And then I had a big challenge, no electricity, no potable water, nothing. So that place, what you see here behind me, it was like a big, deep ravine. So I put about 17 trucks of maram to fill it up. And there was no access from the main road to inside. The whole thing was like up and down. So God gave me idea, and I engaged some, asked quotation from several fundis, and then put culvert and road connection. That's why even a huge truck can come and go safe. We built that one. Then I knew that I had to do a lot of things here to straighten out the ground, to prepare the place for this Medical Mission of Compassion.
Apart from medication, in fact, the people around here have gained, and they are very happy. They have gained health-wise, social-wise, even economically, because even if you go out to get there, you'll find people selling their wares. So everything has been of beneficial to this community. And when I walk around talking to each and every person who has been treated, they really acknowledge and appreciate what the ICC has done to this community. Being that this is the third year, and they said they are going to be here for only 3 years, very many people are still asking, oh, ICC, through Pastor Joseph, why can't you come once more? Because once they are here, they go and they leave the community healthy. The community is healthy. And even when you try to attend the Nyakach County Hospital, you will not find people there because everybody is healed. They give you treatment, they praise, they worship here, so they get treated and they get healed because this is a church activity.
We came here and we have been treated. We thank the people who brought this free treatment, and we really appreciate it. My brother here is suffering from autism. He's autistic, and sometimes he's not talking, he walked just recently. But we thank God for his being here. Yes, he can't eat alone, he can't talk, but by grace of God, he's good. This young girl, she was vomiting and sometimes a lot of fever, but we have come here, she has been treated, we thank.
What started small has grown tremendously. In 2022, the mission reached heights in Pap Onditi, providing medical care to at least 1,500 patients, a number that had never been seen in the region before.
I've been with ICC all along, right from the beginning. When we started in Bondo, we did it for 3 years, and now this is the 3rd year in Nyakach. So a total of 6 years I've been with ICC in this medical mission of compassion. And what I would want to say is that as the mission continues, as the years goes by, we realize that there are a number of people that are being attended to. Like when we started in Bondo, we never covered this much multitude that we are covering in Nyakach. And sincerely, the Nyakach people have come out to make good use of this opportunity, because a lot have been treated in Nyakach for the 3 years compared to Bondo.
This year alone, the medical mission of compassion was able to treat 20,031 patients. And over the past 3 years in Nyakach, they've provided care to a total of 47,331 people. Each patient received not only the medical attention they needed, but also a bottle of water, a packet of milk, and a loaf of bread to take home.
It is not in normal circumstances that you have a camp like this and you see clients to the tune of probably 2,000 clients per day. That is a bit on the higher side. And that is the experience we have had in Pap Onditi. Because we see on the less side, we see on a day that we don't have so many clients, we see about 1,800. And ordinarily we see something like 2,000. That is a very huge number for clients, and considering that the supply of medicines is very, very constant, and the clients have got quite a variety of medicines. And that is why we have realized, like even in this particular camp at Pap Onditi, this year we have had an experience of receiving clients from Busia. We have seen clients here from Kerichos County. We have seen clients from Migori County. I've met here clients from my own county of Siaya, and the majority are from Kisumu. So that gives us an experience that this information went far and wide.
My name is Sharon Vera from Katito, and I am in Form 1 in Mabunga Secondary School. I heard that they are providing health. I was told by my teacher, and I was having a problem, so she wrote for me a sheet and told me to come and seek for medication, and I got medication, and I'm saying thank you for providing us medication.
When patients arrive at the camp, they are welcomed warmly and given a number to make sure everything runs smoothly. They head over to the registration area where volunteers help with the paperwork and provide a medical card. From there, patients wait until it's their turn to see the doctor. Now, let's hear from Pastor Joseph himself as he walks us through the entire process in detail.
And as they sit there, you can see there is a slow progression that happens towards the hall. Then when they come to the hall, then we take them first to the vitals to see the blood pressure, pulse rate, and then we weigh them to see what weight they have, everything. The vitals are over, then they are going to meet the doctor. The doctor will prescribe medicines for them. Whatever medicines the doctor prescribes, they go and pick it up at the pharmacy department, and then off they go via that place and then pick up their food and go. But in the meantime, if the doctor feels they need to go for some more tests, we send them to referral to Nyakach County Hospital. We also give free cervical cancer screening is given to all women free. Whoever is desirous to have it, we give them.
The medical mission may have started small, but for Pastor Joseph, knowing that he could make a difference in someone's life brought him immense fulfillment. Just seeing a smile on a patient's face meant the world to him.
I'm Silas Odipo, an assistant chief around this place from Nyakach, and here is Nyakach sub-county. I'm here with my son who had some bad tooth and currently is being taken care of. I got this information from the media and from our barazas that we usually have on Mondays. The reception has been good. The members of the public are really appreciating. You know, the cost of healthcare has been very high, but now that this one has come, our people are really appreciating. Many people have been treated and they're responding well. So I really want to appreciate the ICC, and please continue doing the same to the other parts of the world. We are very much appreciative, and we welcome you anytime that you feel like coming to Kenya. You are our friends, because whoever thinks of your health must be your friend.
As the sun rises over Pap Onditi, the free medical camp springs into action. All thanks to a dedicated team of healthcare professionals and volunteers. These folks are the true heroes of this mission. Let me introduce you to Dr. Sarah Onyango. With over 15 years of experience, she's here today to provide essential medical care to those who need it most.
This is my third year doing cervical screening. During our first year, we had so many clients who fell via positive and with suspicious cancer. We were worried. Our community was very sick by then, and the intervention had not been done. It was not done. We were just starting when the ICC came in. So from there, we have been working together. The data we got 22 via positive plus the suspicious. So this data went up to our Kisumu County, and as we have been continuing screening clients here, the Kisumu government also decided to bring in other co-workers who have been working behind us. We do first and then they follow. And I'm seeing this year the data has really improved, because we started last week, and by today we have only gotten 4 via positive and 3 suspicious from 22. That means this project has really helped us.
Right by her side is Dr. Kip Tanui, an eye specialist whose compassion and dedication ensures that every patient feels heard and cared for.
When it comes to eye issues, we find that most of the clients you see them here, they have what we call presbyopia. Presbyopia is a condition whereby patients, when they reach at the age of 40 years, they start demanding glasses to read with. And therefore, most of them, when they come to this side, they are coming for the glasses. And other conditions mostly found here is issues of allergies. Most of the children below 20 years, they encounter what you call ocular allergies, whereby you find that they have itching eyes, tearing. They have what you call photophobia, whereby they fear light. And you find that those are the mostly clients we see here. And the moment people grow old, they tend to encounter what we call cataract. Cataract is a condition whereby there is an opaque issue in lenses whereby they cannot see directly the light, and therefore they cannot perceive what they are seeing. And therefore when they reach that age, we categorize them into categories. There are those clients who cannot see completely. There are those who can see light. There are those who can see at a distance of less than 6 meters. There are those who can see 6 meters. And therefore for this condition, because clients are many, what we always do is to pick the one who is in need of the surgeries. And then we book them, then we order them, we prepare them for the surgeries so that they will be called later for the same services.
I'm Lavender Onyango. I work in Bondo Sub-County Hospital. Yes, I work there as an oral health officer in the dental department. And we are so much privileged to be here to help people out in various problems in this camp. We are receiving more patients with bad tooth. Yeah, most of them have abscess, which is quite challenging to us, so we have to refer them for further treatment. Yeah, but for the tooth extraction, we thank God we are helping them here, and patients are very happy.
I work to the Kisumu County Government, Department of Health. Professionally, I'm a physical therapist. Yeah, so I'm also here to help with the medical camp organized by the ICC. I provide services last year. This is another year that we are able to be part of the ICC. If I may talk of our department, the numbers this year is bigger, is more compared to the last year.
My name is Vinita. I'm from Chapel Hill, North Carolina. I'm here part of the medical mission with the International Community Church of Cary, and we've been friends with the church for a long time, and I take this as a privilege to come and take part of this medical mission. And today I had the opportunity to visit the physiotherapist here, and I had a really marvelous experience with him. He was really professional and was able to cater to my needs, and I feel a lot better already, and I would highly recommend him. And again, like I said, it's part of the church, and I take it as a privilege because God has given us a lot of resources, health, and the capacity to come here and share His gospel with the people here.
I joined Medical Mission of Compassion in 2017. That is now 6 years ago, and it has been a good experience. Yes, when I joined, I came in as a medical officer who just helping to treat patients. Then from there we created a bond with Pastor Joseph and the ICC team, and they asked me to help them out wherever they're doing the medical missions in Kenya. And so for the last 5 years or so, my work has been doing what we call community entry on their behalf. When they identify a site, I go there on their behalf. I talk to the community, I talk to the leadership there. Then I organize the healthcare staff, and basically I give them advice on how to structure and restructure the human resource. Besides helping ICC to organize the mission, I also help by seeing the female patients, especially those with issues of female health. Yes, for us to manage our healthcare workers quite effectively, the numbers guide us. So as we start day one, we have lower numbers. For example, pharmacy we had 6 people on day one, lab we had 2 people, dental we had 2 people. But the number is increased now. Today we have 10 pharmacists, we have 10 clinical officers, we have 3 dental personnel. So basically as the numbers increase, we are adjusting our numbers upward so that the patients are not able to wait for long. They're able to get quality service, not from third clinicians.
But it's not just the medical professionals who made this camp possible. Volunteers like Winston and Joshua are working tirelessly to make sure that everyone receive not just medical care, but also essential supplies they need.
I'm happy to see how different persons from the vulnerable backgrounds have been assisted, and also how they get, apart from that, health out of their health challenges, they have been assisted with the different medical attentions. I'm also happy here because I'm able to see how they're serving the Lord through the Compassion Missions works.
I was lucky to be at the eye department, and I would like to talk about some small things about the eye department. From the day we started, which was on 15th, Monday, the turnout was, we managed to receive a total population of 1,555 guests, but in the eye department we managed to assist 231 patients, and with time the number of patients have been increasing, which has been positive towards our work. And I also want to thank the whole of the International Community Church for their heartfelt gesture. Yeah, they managed to bring up this program, which is going to assist a lot of people, especially the sick and the people who are lacking basic needs like food.
My name is Joe Deveraj. I'm from Cary, North Carolina with ICC. I came here with ICC as part of the MMC, Medical Mission of Compassion, and we're helping giving free medical consultations and treatments to thousands of people in the Pap Onditi area of Kisumu, Kenya. This is my 6th time in Kenya. I did 3 years. We did the medical mission in Bondo for 3 years in Siaya County, and now this is our 3rd year of doing it in Pap Onditi. So this is my 6th time here, yes. Just like seeing, just the love of God, just wanting to share the love of God with people in disadvantaged people across the world, and helping them, giving them resources that I have back at home, and making sure that they can also have those same resources and treatments available to them. This is a great opportunity. It's very life-changing. You interact with different types of people you don't get to interact on a daily basis back home. So I think you should let the Lord, if the Lord wills, you should let Him work in your life and come here and serve these people. Thank you.
This dedicated team, united by a common mission, is transforming life and bringing hope to Pap Onditi. Together, they are the heart and the soul of the medical camp. And beyond the medical care, the medical mission of compassion is also supporting free computer training for the youths from poor backgrounds and hosting the Nyanza Pastors Bible Conference. This life-changing event was made possible through the incredible support of the International Community Church in Apex, North Carolina. But our work is far from over. We need your continued support to keep this initiative alive and to reach even more people who need our help.